Mapping of face. Mark the infraorbital rim 1. As the contralateral side may differ, both sides should be individually mapped. Product placement should stay outside of the orbital rim. If the level of the two rims differs, lower the line of the higher rim to match the level of the lower rim. Mark the infraorbital foramen 2. Its location is usually 5 mm below the inferior orbital rim and in a vertical line with the patient's mid-pupillary gaze. Use a cotton-tipped applicator to find this subtle depression under the skin. Ask the patient to verbalize when they feel nerve irritation. First cheek apex line. Draw a vertical line from the lateral bony orbit 3 in an inferior direction. Second cheek apex line. Draw a line from the midline of the chin 4 through the oral commissure. This line will intersect the first cheek apex line at approximately the apex of the cheek. How to check the cheek apex? There are two techniques to check if the apex of the cheek has been found correctly. First, mark the superior and inferior borders of the zygomatic arch. 5. How to check the cheek apex? Technique 1. 6. Draw a line from the base of the nair to the mid-zygomatic arch. This line should intersect your prior markings at apex of the cheek in most patients. How to check the cheek apex? Technique 2. 7. Draw a transverse line that is 2/3 inferior to the nasal radix. This line should intersect your prior markings at apex of the cheek in most patients. Cheeks. Injection technique using a needle. Bellotero volume. Insert the needle at a 90-degree angle into the supraperiosteal plane of the skin and place microbolus. Mold away from the infraorbital foramen. Be careful not to force pressure on the plunger, making a large aliquot. Injection technique using a cannula. Bellotero volume. Make the insertion point with an appropriate needle. Insert the needle, advance it to the periosteum and move the needle from left to right. Lift the skin with needle, bevel up, and retract it from the skin. Insert the cannula. Pulling the skin away with the non-dominant index finger and thumb makes it easier to advance the cannula through the insertion point and skin. Inject multiple strands of filler using the fanning technique in a retrograde manner. Maintain depth to inject at the supraperiosteal level. Maintain depth to inject at the supraperiosteal level. Gently shape and mold the material to the desired cosmetic effect.